Welcome to Wellness Waves, your go-to radio show brought to you by the Asian American Pacific Islander Nurses Association of Nevada. Join us as we dive deep into empowering, advocating, and amplifying the voices of our amazing Asian American Pacific Islander right here in Nevada. Powered, of course, by our main sponsor, PHLV Radio. Get ready to ride the wave of inspiration and learn how nurses and our community partners are making a splash in the state of Nevada, one caring heart at a time. Let's catch some wellness waves together where we can talk freely about anything that will lead to healthier lifestyle in terms of physical, mental, spiritual, and financial well-being. My name is Ray Serafika. I'm a nurse, an educator, and a board-certified psychiatric mental health nurse practitioner based in Las Vegas. I am also the immediate past president and one of the founding members of AAPINA of Nevada. Today, we are fortunate to invite the officers of the Executive Committee of the AAPINA of Nevada, and I will let them introduce themselves, who they are, and what are their roles in the organization, and how they were recruited in the organization, starting with our current president, Dr. Zara Burinas. Zara?
Yes, good morning. Good day, everyone. So basically, I am Zara Burinas. They call me Dr. Z. That's my screen name. So basically, I'm one of the professors. I'm an assistant professor at Nevada State University. I've been with AAPINA since the beginnings. I'm one of the founding members, actually. And how I was recruited is when we were talking in one, it's just like a community event, and we were talking about how we could help our future nurses. So I was one of those chosen one because I am an educator at the same time. So I was enticed of educating our future nurses. So I was able to get into the other professors or other members who are really into the same wavelength. So we wanted to educate our nurses, and we wanted also to help the current nurses, especially to let them know the importance of self-care so they could prevent burnout in the future. So I'm so happy to be here today, and I have also my executive members in here, and we will explain everything all about our organization.
Thank you, Dr. Burinas or Zara. The next is the president-elect, Dr. Andrew Reyes.
Oh, hi. Thank you, Ray. So my name is Andrew Reyes. I am an associate professor at the University of Nevada, Las Vegas at the School of Nursing. I am also a nurse. And with the AAPINA of Nevada, I am the president-elect. Thank you.
All right. And next is our secretary, Dr. Hannah Lee.
Hi everyone, my name is Hannah Lee. I'm also one of the faculty at UNLV School of Nursing. I'm honored to be a part of this the executive council of this AAPINA of Nevada. I've been member in AAPINA of Nevada like a few years ago, but then I was one of the national member because AAPINA is now national and international organization, and I'm secretary for this group, and I'm happy to be here. Thank you.
And lastly, the youngest member of the executive committee who serves as the treasurer of the organization, Ms. Case Guido.
Hi everyone, my name is Case Guido. I'm a bedside nurse at Valley Health Specialty Hospital. I've been a member of AAPINA of Nevada since 2019. I was recruited as a student nurse. I spearheaded the Roseman chapter of the AAPINA of Nevada and to help it get established. And then after graduating, I continued on with my relationship with AAPINA of Nevada. And Dr. Z actually recruited me last year to be treasurer. So I was very honored to be part of the executive board of AAPINA of Nevada.
Thank you, Case. So as you can see, we are very diverse with our talent, with the years of experiences, seasoned, new. They bring something to the table, and that makes this organization really interesting and exciting. So one of the questions that we have in mind is for the president of the organization, Dr. Zara Burines. Could you please share with us what drives the Asian American Pacific Islander Nurses Association of Nevada, and why is it important to minority nurses like us? Why do we have to join an organization? Why do we have to belong?
Oh, thank you so much, Ray. That's a great question. So basically, one of our mission here at AAPINA is to have a unified voice and help the community. So by joining this special organization, especially us, the minorities, we will have a voice, a unified voice that could express of who we are and what is our stand in helping other people. Because, as we all know, nurses is one of the largest profession, no matter what, here in the U.S. or outside the U.S. or in a universal platform. We are still one of the best and the biggest organization. So then if we will be linked to each other, we connect to each other, there is a possibility that we could change. We could change some of the laws. We could motivate others to be in the same page. What are the things that we wanted to change, especially when we take care of other people? So as Asians, most of us also is in the field of, medical field, especially the nursing. So through us, we could relate to them, we could collaborate with them, so we could improve on how we could give care to our people. And another thing too is we are also in a mission to help our future nurses. Basically, if you will come to us, we have some continuing education episodes that we could help them to see what are the evidence-based practices that we could have, so we could have a quality care as well. So those are the two main reasons that really drive me to help other people, so we could have quality of care in the future.
Thank you, Sarah. And as a nurse myself, that's something that we push every time with our students, to be safe and to provide not only competent but also quality of care. So there should be that standard.
Yes.
So if you for those aspiring nurses, those are the two things that we really go by as nurses. So my next question is for our president elect, Dr. Andrew Reyes. Could you paint us a picture of where you see the association heading in the future? What's the big dream or vision you are all working towards nowadays?
Thank you, Ray. So our big vision really is to be the go-to association, go-to professional association for Asian American Pacific Islander nurses. But it's not only open for those who are on the Asian Pacific minority, or racial background, but it's open to everyone. But we really want to be that, as like Dr. Zara Burines said, we want to be the unified voice for Asian American Pacific Islander nurses. So our big dream is that we want to be that the go-to organization. And what we do in order to proceed to that vision is we support our nurses in terms of their professional practice development, and also to build collaborative partnership with the community, so that they too, the community can partner with us, so that because we are the go-to organization to help improve the health of Nevadans and beyond.
Thank you so much. And that brings me back, because I started as an ICU nurse. So in terms of, getting connected to the association, of course, the default as organization at that time is the critical Healthcare Nurses Association, right? So why not do, if you belong to a certain minority group, then why not go to this type of association? So on follow up with that, Dr. Reyes, so tell us a little bit about the cool stuff that association is up to right now. Any exciting projects or events that our audience should know about?
Well, while we're recording this episode, it's actually May 2024. So this month of May is actually considered the Asian Pacific American Heritage Month. In the 1990s, the U.S. Congress passed a law to designate the month of May as the Asian Pacific American Heritage Month. So for us, the AAPINA of Nevada, we are organizing a bowling meet. It's more like a social activity on May 18, Saturday, which is about 2 weeks from now, May 18, Saturday afternoon in Henderson, Nevada. And this is a free bowling meet for members of the AAPINA of Nevada. So we want our members to be engaged in the organization. As part of our fulfilling our vision of being the unified voice for Asian American Pacific Islander nurses, we also have continuing education seminar. We have one coming up this coming fall. And of course, we have our annual Christmas holiday party, which is usually every first Saturday of December at Gold Coast Casino. And during this holiday party, we acknowledge the achievements of our members. We also award scholarship to nursing students to support their education. So for those listeners out there, please visit our Facebook page to know more about our activities. And when you go to Facebook, you just simply type AAPINA Nevada and you will find our page right away.
All right. Thank you for that.
And there's another group, another activity that we will have. Remember our international gift giving on December.
Oh, yes.
So we also partner with our community back in Culaba, Biliran, Philippines. So we are sending boxes for our kababayans who are really not really well off. So basically they're less fortunate. So AAPINA is one of the sponsors in giving them gifts. We will give them food, clothing, toys. So to the people of Culaba, so we will be exploring now, not only national but internationally. So that's a new project that we will be doing this year.
And there's always that healing that occurs when you give.
Yes,
right?
yes.
And I think I know Zara for many years, and that's one thing that I really admire on her because of her generosity is kind of contagious. Like if Sarah doesn't call you on something, I mean, you are really missing out a lot when in terms of a project. So again, as a follow up to Dr. Reyes, for all the aspiring nurses out there, or even nurses already, or even nursing students who are looking for that affinity group, such as the AAPINA of Nevada, how does the association support and champion nursing students on their journey?
Yes, thank you, Ray. So scholarship for students is one of our main focuses in our organization. We are just so fortunate as an organization to receive generous donors who really just see the significance of nurses in our healthcare system. Just like in COVID, we've seen how nurses were very, at the front lines, were very instrumental in saving numerous lives during COVID. So therefore, our organization as nurses, we see the potential of nursing students. We all know that going to nursing school is not cheap. Students struggle with the financial expenses associated with nursing education. So therefore, we financially support nursing students by providing scholarships. We also have programs to train students to become the next leaders in our community. So for example, we provide mentors to nursing students, and usually these mentors are already registered nurses. So this is an opportunity for mentors to help students, guide them in navigating with the challenges of their nursing education, and to help them clarify their nursing career goals. So for example, whether they want to be nurses in the hospital, in the community, in the clinic, in emergency rooms. So as an organization, we see nursing students as the future leaders in our healthcare system. They will be the chief nurses in the hospitals, advanced practice nurses, educators, professors in the university, researchers, and many more. So therefore, we are here to pave the way for them to fulfill their dreams.
I like that. And for our audience, nurses are mentors. They are not only educators, not only researchers, but by nature they love to mentor other people or new nurses. I was given the opportunity to receive those mentorship earlier on when I was starting, and now it's time to give back. So I kind of mentor too other new nurses into the profession. But going back to that, Andrew, so if there is like a potential donor who wants to start a scholarship or wants to do something for our nursing students, so what do they do? How do they start, and who do they need to contact?
Yes, they can contact us through our Facebook page. Unfortunately, right now we don't really have a website yet, and that is something that we are pursuing right now. But they can always, generous donors, you can always contact me. I am available. If you will just, even you just Google our organization, AAPINA of Nevada, you Google my name, Andrew Reyes at University of Nevada, Las Vegas, you can always contact us. Yeah.
All right. Thank you for that. Do you have anything to add, Dr.
One thing
Barinas?
that I would say is they could contact us also in our Gmail. So it's the AAPINA NV at gmail.com. So you could just give us any hint of who you are, and we will get back to you for more information.
Mhm. And if it's not clear to them what they can do for that sponsorship, we will give them guidance. We will
Yes.
set the particular scholarships that we know that it can help our
And
students.
also, in addition to that, also, Dr. Serafika, we are a 501c3 organization.
good.
And
Yes.
in the United States, when you're a 501c3 organization, for donors, we are happy to support you in writing off your donation. We will give you a taxable receipt.
All right, that's even better.
Yes.
All right, so we will take a short break for now. We're talking to the executive committee of AAPINA of Nevada, and we'll be right back. And we are back to Wellness Waves with AAPINA of Nevada, powered by our main sponsor, PHLV Radio. Again, my name is Ray Serafika. I'm the immediate past president and one of the founding members of AAPINA of Nevada. And we are talking to our current executive committee on how they're doing, what exciting projects and things that they are sharing to the community and to our members. But before we move on to our next set of questions, on behalf of AAPINA of Nevada, we would like to thank and acknowledge and wish our founding president and former host of Healthy Mondays with AAPINA of Nevada, Dr. Mary Faye Axon Armstrong. So Mary Faye, we wish you well in your new journey and best of luck in pursuing the new opportunities for you. So we will miss you. All right, going back to our question, this is really exciting. Let's talk to Case this time. Let's talk about community impact, Case. How does the association makes a difference in the lives of not just nurses, but also to the broader community?
The organization makes a difference in the lives of nurses and the broader community by advocating for healthcare policies that improve patient care and access to quality services. Through educational programs, resources, and trainings that we also do webinars, nurses are empowered to provide better care, positively impacting individual health outcomes. Additionally, the association engages in community outreach activities like giving out blankets to the homeless, and also like food usually give us like the food and the resources to actually give out to the community as well. And we also participate in health screenings and flu vaccination clinics and awareness campaigns to address broader public health issues and promote wellness in the community.
And I remember those days, Case, when you were a student and at your former university, and you were an active officer, and you were so engaged in those activities and projects. One thing that we like to do too as nurses and members of AAPINA is really to reach out to our community, because like our students, they are more trained in the hospital setting, acute care. There's only a limited time for them to be exposed to what we call now the social determinants of health, where they really talk and interact to the less privileged members of our community, and by that, those kind of experiences sometimes they don't teach you in school, right? You experience that by means of exposing yourself to the most vulnerable populations, and that to me is true learning that can happen outside the school settings. So kudos with that, you know. Now going back to our president, Dr. Zara. So are there any juicy details about partnerships or collaborations that help bring the association's mission to life? Are there any things that you can share with us in terms of like what you're brewing out there in the community?
All right. Thank you so much, Ray. So this is now our time to explode the resources that we have, because you know for a fact that we cannot stand by ourselves alone, right? So we have to collaborate with other organizations in the community. So first partner that we usually have our Asian Community Development Center, so they're the ACDZ. They usually help us provide some food, some like money as well to support some of our projects. Or in fact, last month, they also help us give like donations, free food to our communities, especially the students. So we also collaborated with them when we had our blanket drive and our food for the homeless. They were there for us. So another organization that's always supporting us is the ACRC, which is the Asian Community Resources Center. They usually come to us and give some donations as well. They come to our events, and we, Dr. Reyes and myself even like join them with their project, the Winter Wonderland giveaway of food last December. That was really fun. There's tons of people who were able to get the free food so they could have food on their table on Christmas Day. We also have some other organizations like the Philippine Nurses Association. They're also with us when we educate our nurses. We usually have like continuing education. So the one fun part that we did is about our AI. So that was a lot of audience that we have. It impacted a lot of professionals out there, and also the students. That was really one of the best continuing education that we had done. We also partner with our PAFARNA, the Advanced Practice Nurses Association. So basically what they do is they come to us during our blanket drive and food for the homeless. Their president was even there with us while we were giving food for the homeless. It was just like very humbling that we have the capacity to reach out to other people in our small little ways. As nurses, it is very amazing. That's why I'm encouraging people to join us, because it's really great. Additionally, we also have some partners with the church. So the group of Father McCain, I should say. I used to use doctors because we are nurses, but Father McCain's group is always there for us when we have our blanket drive and food for the homeless. They would encourage us to give them food, and they will be there for us during the food distribution, because we need a lot of people so we could give or distribute the food evenly to the homeless. And we also have, of course, our collaborators when it comes to scholarship. But remember, we're also funding the students. So some of our sponsors are Dr. Francisco C. We also have Brian Koviak. They usually give us money so we could sustain our scholarship program. Additionally, we also have the Advanced Practice Psychiatric of Nevada. They are always there for us. Cora and Proxy, there's also one group there led by one of our nurse, which is Melody Nolos. So she is the owner of the Cora Proxy, and they usually give us tons of blanket so we could give this to the homeless in chilly weather. And not only that, we also have our New York Diamond Exchange. Boy, we are so happy that we partner with them. They usually give us jewelry. So these jewelries will be auctioned so we could have funds for our organization so we could support our projects. They are amazing. We could have this diamond rings, diamond like necklaces, many others, and earrings or whatever. We have this on our holiday parties most of the time, and they really is one of our major source of income because they are really like free money for us.
Correct.
So thank you so much forever. And lastly, we also partner with our schools like the Nevada State University. We usually, ask some like souvenirs from them, and also the UNLV. So those are our partners, and we are also willing to partners with other organizations who wants to partners with us as well.
Thank you so much. That's a very comprehensive. So, our audience, take notes of all those details, because if you don't have anything to do before listening to our show, now you do, and get involved. So, our next question is directed to our secretary, Dr. Hannah Lee, and we know, we kind of like in the middle of this inflation. There's a war going on. And food insecurity everywhere. Organizations, are having challenges. So, how do you keep the association thriving and growing amidst this changing, not only healthcare, but also economic landscapes and needs? How are we surviving, or how do we have a plan for that?
Thank you. I guess I think those listeners who's been listening to up to this point kind of heard how our organization help the community and then work with other partners and to address some of these healthcare issues and financial issues. So basically my answer is we're gonna keep continuing our efforts. So mainly we have maybe several key principles, which include we're gonna continually prioritize staying abreast of current trends, research, and policy changes within our healthcare sector and also our community. So this ensures our initiative and programs remain relevant and responsive to shifting needs of our members and the community they serve. So again, you heard from our president and president-elect, the events that we've been hosting and, holding successfully, including the professional development, like CEU events and so forth for our nurse members and advanced nurse members as well, and student members as well. So, for instance, I think this wasn't addressed before, but last year we have Preventing Identity Theft webinar for our nurses, which was really timely and also really helpful, informative for our members as well. And also, I think this was addressed, collaborating with other health organizations like Filipino Nurses Association of Nevada, Filipino American Advanced Practice Registered Nurses Association. We hold a day-long, very successful CEU event about maternal and child health, which is really one of the key topic in healthcare in Nevada. And also, scholarship for linking our mentees and mentors. So we kind of try to grow our future nurse leaders in our organization. And also, I wanted to mention that we will continuously foster a culture of innovation and adaptability. We continually seek out new opportunity for collaboration with partnering with other health organization, academic institution, and community groups. Finally, we maintain active and open line of communication and engagement with our members. So we actively solicit feedback and inputs from our membership through surveys and meetings, and also our other channels like email communication. At this point, every active member and also former member receives their happy birthday wish email message that contains our organization's recent information updates, which can inform them what we are doing at this moment. So, in summary, our approach to keeping our AAPINA of Nevada thriving, growing is grounded in adaptability, innovation, collaboration, professional development, and member engagement.
Thank you so much, Dr. Lee. So to follow up, because I know one of your responsibilities is to keep up the members, the membership. So if someone needs to be a member, how can someone be, to apply for membership of the organization, and how can other organization be a partner for AAPINA of Nevada or with AAPINA of Nevada?
Yes, thank you. Becoming our member of AAPINA Nevada is easy and open to anyone interested in promoting our goals and objectives of our organization. So you can simply, like I think Dr. Reyes mentioned, contact us by visiting our Facebook website, which is www.facebook.com/AAPINANEVADA nurses. So that's all one words. Or reaching out to us to our Gmail, AAPINANV@gmail.com. Or we also have one more email about membership. So AAPINANV.membership@gmail.com. So membership benefits include access to networking opportunity, educational resources, professional development opportunities, and participation in advocacy efforts that advance our interest of AAPINA of Nevada and also our patient in Nevada. So for the any organization interested in partnering with AAPINA Nevada, we welcome collaboration with like-minded entities that share our commitment to promoting diversity, equity, and excellence in healthcare. So again, anyone can reach out to us using same information, Facebook, again, facebook.com, AAPINANV, Nevada Nurses, or two Gmails account to say AAPINANV@gmail.com or AAPINANV.membership@gmail.com. We can definitely help you to explore any potential collaboration opportunity, such as joint initiatives, sponsorships, resource sharing arrangement. So, we welcome any of your, contact and interest.
Thank you so much for those information, Dr. Lee. That's very, very helpful. So now, our last question is for Case, because, we are AAPINA of Nevada. We take care of minority. We take care of diversity. So diversity is really the key here. And how does the association ensure that diverse voices and perspectives are the heart of everything that we do? Case.
We want to emphasize that AAPINA of Nevada is not only for, Pacific Islander and Asians. Anyone who supports our cause can join our association, and we welcome everyone. And the association prioritizes diverse voices and perspectives by fostering teamwork and shared governance, where members from various backgrounds contribute to decision making. Monthly meetings provide opportunities for inclusive discussions, while the newsletters and social media platforms amplify diverse voices and share different viewpoints. Regular feedback from members and sponsors ensures ongoing alignment with the diverse perspectives in all our activities and initiatives. respectively. Yeah.
All right, thank you. And those are the things that we keep doing, and we kind of monitor and always explore ways on how to enhance, the diversity. As what Case has mentioned, we are not exclusive. We are actually inclusive group, so anybody can be a member of this organization. So there you have it, my dear audience. Thank you. Maraming salamat po. It was a pleasure to have you all in our Wellness Waves radio program. We hope that you learned something today from our guests. I did. So from our executive committee of the AAPINA of Nevada, thank you again for being here today. We are looking forward for the next episode. Until we meet again, stay safe and healthy as we all ride the wellness waves with AAPINA of Nevada. Thank you.